put that information to use. That was pretty interesting.
I think it also does advance another objective of the committee, which is just what can we do, right?
Yeah.
With existing data and information is what could we immediately do?
Right. And so to Jocelyn's point, if she has health equity zone data that she could bring and share with us, that would be really good. I'm an old healthy places by design person. So I mean, it is because of that program that I do anything at all in town.
Yeah.
Because it was very satisfying to be involved in.
Two different topics, you know, and the health equity issue is that the zones that have been established over the last, I think, 5 years since health equity zones were created through the community health centers have now abruptly shifted. Everything is abruptly shifted with COVID. You know, we have areas where residents were extremely satisfied and comfortable with their quality of life, and that has abruptly shifted with the loss of employment. And no hope of continued employment. So there, you know, the only thing I would currently have is old data, but what's going to be a thrust is going to be looking at collecting new data and seeing where are our areas where people can access healthy spaces and healthy opportunities, healthy food, healthy health care, so forth and so on. So that's the point.
A couple of things. Henry, one, I'm not actually in possession of the permissions to allow you to share. However, my screen sharing is active. So if you want to email me Jonathan's item, I should be able to post it from my screen.
All right, let me do that.
And then a thought occurred to me while everyone was talking about, you know, where does the legitimacy come from? Where does the mission come from? One place to look is the council's established goals. Well, the council has set goals for the local government, which include, they're pretty broad. I mean, the healthcare goal, I think there are 2 of them. They're pretty broad, working cooperation with South County Health Administration to help ensure long-term viability of the South County health community's healthcare delivery model. I think, you know, that's a pretty broad goal. Work in cooperation with South County Health Administration across areas of mutual interest, including but not limited to the town's public safety functional areas. Those are the 2 sort of health goals that the council has set for the town. One way to you know, sort of get mission direction would be to have the council revisit those goals and sort of put some focus on them. And I'd be happy to, you know, carry that conversation. But they're also broad enough that if you wanted to suggest to the council that those 2 broad goals could be furthered if we did this following, you know, analysis or study or worked with these groups to understand what's going on, I think you could probably make that work. There are probably 28, 29 different goals that the council has set. There's room in there for pretty much anything that might be of benefit to the community. I mean, the council's goals are pretty broad deliberately. They want to make sure that there's a basis for taking action in a lot of different areas. So the goals are one place to look. The housing goals, it's everything. There's the education goals, there's the communication goals. There's a goal related to pretty much every topic, and they tend to be pretty broad. There's a larger list of objectives that sort of hones in on those goals a little deeper. So that might also be a place to look.
I've had some kind of, as we're talking and going through some of these past meetings, we saw a really good presentation from GIS and the police. It started to show us what kind of information might be available. And this is, I'm going to bounce around here almost on these agenda items under 5, but it's so one of the things that we have clearly struggled with from day one is creating a mission without really, we don't agree on it. So there's like this sort of drift on that. And yet we still, everybody kind of knows what information looks like. So the more information we have access to, the better, really. So I'm wondering if maybe we just start talking about things like the data repository, who's coming in next meeting, what kind of information is available. I know that during the GIS presentation, and I've seen this in my own information systems of my own business, once people start realizing what they have, then they want more in the form of information. She mentioned that she creates maps for everybody constantly. I think any of those maps, assuming they're public record, which I think they are, maybe those should start being any information that's put together can come to this committee as a matter so that we can review it. And then as we start to see the kind of information that's being requested and regularly available, we can start to understand a little more of what we're doing. You know, that just kind of, because as, for example, the police started talking about the old Tower Hill Road project, and I started to think, okay, what information might we have to validate those decisions? Just the more we talk about information, the closer we get to being able to help. I think the idea of the mission is stopping that from happening. So that's all.
So I'm sure that Carol would be happy to produce a map of the month for the committee. And I mean, honestly, she's done that for me. Before COVID, we were moving toward a map of the meeting for the council. That got blown up with COVID, but
yeah.
I think there is virtue to just looking at the data and seeing it. And maps are a beautiful way to do it because they're concise.
Right.
Everything got blown up by COVID, didn't it?
Yeah.
Everything.
So this is Jonathan's statement, and I do remember this conversation, and this does seem like a very reasonable activity for this committee.
Is anybody else seeing this webinar is being recorded?
It is
Yeah.
being recorded.
I know, but do you see, is there a big sticker on your screen that says that?
There was, and then you just accept it, or you can leave the meeting if you're not comfortable with
Yes.
it.
Well, I don't mind being recorded, but if I click, oh, sorry, okay, continue. Okay, thank you. Sorry.
So the only recommendation, I like this, Jonathan. The only thing I would add would be in that last sentence, the SMART committee could also assist in presenting data, results, conclusions, and recommendations.
Mm-hmm.
I like the idea. I don't like to just present data without presenting some kind of solutions, just the way I'm driven. And that's the only thing I would add. I like this.
And one of the things, if I remember the conversation from a couple of meetings ago, one of the things that was contemplated was that folks who had an interest in talking to a particular committee would just do it. So if this is your sort of template, you know, individuals are free to, there's no reason why you shouldn't be free to just sort of work with this as the template, but, you know, email the committee chairman of the committee you'd like to talk to. And, you know, if you need to change what you say here in order to reach out to that committee in a slightly different way, I think you could do that as well.
Rob, could that be centralized through town hall so that it's not just kind of like we're waiting to see who reaches out to who, but it just gets pushed out to every commission and committee, and it's just sort of the SMART committee exists and this is their mission, and if you have particular questions that you need technical assistance with, that the SMART committee can provide, let the SMART committee no, and they will take it to their meeting for discussion. And that way, just everyone's getting the same message and the same information and the same invitation to bring questions to us. So it's
Right.
not like a ragtag,
Yep.
So catch all, kind of depending on who knows who.
So we certainly could email this to every committee. That's fine. I would suggest that follow-up by the SMART committee members is going to be necessary if you're going to, I mean, what Susan and Henry did is really how this is going to work, I think.
Yeah.
To the committee, and the committee was happy to engage in the conversation. If you had it up to the committee to decide whether or not to reach out to another committee, I don't know what's going to happen. It's just hard to know. Folks are polite, but they,
Might we add a small statement about how this committee could also help with designing data collection? Because that does seem like a particularly unique and valuable skill set that we have. And as we all know, the quality of your evaluation and analysis is fundamentally contingent on the quality and process of data collection. And it seems like we might be particularly well positioned to make those processes higher quality.
I agree.
Yeah, I think so. I think so too.
Yeah.
I'm not sure I understand what the difference between a result and a conclusion is in that last sentence, where if we take Jocelyn's thing, we're going to put in recommendations as well.
Well, I mean,
I guess there is a difference, but
there's a difference. I mean, a result is, a result of the analysis. The conclusion is how it relates to, how that data relates to what we were talking about to begin with.
The question.
yeah, okay.
And you have to situate your result in the strengths and limitations of the data collection to begin with. So it's really more of an interpretation within the context of what the data can actually tell you and what they're limited to tell you. Because there's always error built into any data collection. And so that needs to be framed contextually when data are presented
Okay.
in a conclusion versus just providing the number, numerical results.
So did you highlight this, Rob? Did you move it somewhere? Are we going to address Kirsten and Jocelyn's suggestion?
yes, I've put it here in this second clause, I guess. The SMART committee can assist in data collection, which is really Kristen's point, although data collection and data collection design are different. I don't know if I'm doing any injury to your concept there, Kristen.
I think I'm more along the lines of like study design, or even the evaluation of appropriate metrics. So, I mean, I would refer to it as research design, but that's probably not the right term for this. And so we might say the design, I don't know, let me think about it for a minute. It's been a day full of online meetings, and so my brain is a little foggier than I'd like. What I'm really talking about is, if we might be well equipped to do something like talk about why a survey design isn't going to yield the answers that somebody thinks, or the type of information they're collecting is actually not going to be useful. Maybe in terms of the sample size, maybe the sample's inappropriate. I mean, it really is a research design issue, right? Do you have the information that you need, or are you collecting it in a way that would be meaningful? And accounting for measurement issues and other types of things. Like, I think that there's a lot of expertise in both different forms of data collection, and then understanding where the noise in that data is and how to minimize it. So I would like to see I think a lot could be gained by collecting cleaner data, or data that's more specifically related to the question that people want answered. And it takes a lot of training to do that well. We all know that. So
could you say protocols for data collection? Would that capture everything? Because I think that's really what it is that we can assist with establishment of protocols for data collection.
Not only protocols, but I think methods also.
Yeah, well, the protocols include the method. I mean, that is the method operationalized.
I definitely like to steer away from the idea that we're actually collecting data,
Yeah.
not planning on being a data collector.
No, but
Yeah.
Okay, do we want to move on?
What is the plan here? Are we gonna adjust this and come back to it next month, or?
If you want to work through this now, I don't mind having
yeah, let's just
send
do
it
it. We
out
don't have to come back to it next week.
tomorrow.
It's too much time next. And I think we're very close, so I don't think it would be good to postpone it. But
So I think there's two things. So this blurb is about how we can approach other committees. Is this our mission statement, or is there more? I mean,
oh, that's a good point.
that's what the first sentence says. I like the idea of bringing in data from other groups, and I definitely think that we should be adding the protocol development piece as something that we can provide to them. Some of the issues I've had come over the past couple of months, especially last month, was it wasn't clear that there was a need for us to help the GIS group or the police department as much. And I think that's where we can provide the most benefit is in designing how data should be collected for these. I think that's the value we can provide to these groups. They've been doing their own thing for a long time, and people can be possessive of their data and how it's collected. So I think that needs to be in here, and some idea of is there anything, are we anything more than helping other committees do their work? Over the past several years that we've had different iterations of this committee, we've been trying, had the broad idea to have an economic model of the town and bring data in for our purposes to come up with some understanding of what's going on in town. And that part of it has kind of gotten lost with this iteration. So if anyone has any thoughts about that, and if how are we using this data to kind of coordinate an understanding of the economic and social issues in town.
So Jason, I've had that, dream of having a sort of nice little tight model of the economic inputs and outputs of the community for a long time. I'd love to see it. I recognize that it's a monumental task, and it may be achievable, or we can achieve many of the same objectives, I think, if we can start gathering information and start doing systematic analyses from all of the different vantage points. I think I've pointed out we have 24, 25 different committees. There's a committee that deals with housing. There's a committee that deals with energy. There's a committee that deals with all of these things. There's a committee that deals with health, although it's sort of on the periphery of the town government. But there's all of these places where if we had better data and we actually were getting the inputs from there, we might be able to make something of it. And I think these things come together at some point. I think at some point, the model, the framework gets filled in by all of these other things falling into place. It's not as neat. It's not as clean as working.
Yeah, I agree. It's not, it shouldn't be, and not necessarily something that needs to be in the mission statement, I guess. This is what we're doing. Like the first part of that approach is to collect data. And in collecting data, part of it is making sure that it's quality data and it's useful. And, you know, building a how-to guide of how to collect data is definitely part of that as well. I look at it a little bit more holistically on the long term, that I would like this committee to create something of value, more so than being a data analytics shop for other committees. I don't know how to word that in a mission statement, but so I think I'm good with this with this blurb as to how we approach other committees to coordinate, as long as we add in some protocol information. But I think over the long term, this is a discussion that will have to continue beyond this discussion.
Okay, quite honestly, I'd like to think about this a little bit and see what data elements are out there and see what I could put together. Because I'm going to need a little bit of time to do it, though. Next meeting.
Henry, it's Jocelyn. I'd also like to see what the committees would like from us. What do they want? I don't really even know. I've talked to a few other members from other committees, and I sort of get a sense they really feel like they need help with data and information. But is that something we need to look at? Is what do all the other committees want? I don't know if that's something we should be asking.
Well, Justin, we could definitely do a reach out to them and ask them, what kinds of data would you want to look at?
Yeah, I wonder if that would be helpful. And how do you want us to look at it and ask what do they want from us?
Yeah, and how to present it. What's the data elements that you're interested in? What are your touch points? I mean, we could definitely get that in terms of affordable housing, economic development, Susan and my own committee. And also as you go down the planning, zoning, like if we're going to do planning, I mean, one of the things we'd want to know is how many lots are available in South Kingstown to build on, because we continue to talk about housing and what's available. I mean, we might come back and say, oh, there's only 140 lots available, and doesn't seem like with that kind of availability that you could do anything really big to address the issue of housing. So then we may want to go down another route.
I guess just asking all the different committees, what can we do to support your mission and your activities?
I think it's a two-part question. One is, what are the issues that you really want to know that you don't know how to answer, right?
Yeah.
And then what information do you have that you don't know how to evaluate, or you would like evaluated, or would you benefit from some systematic evaluation from it? Because I think those are distinct contributions that can be made. So
I think you've got an email that is viable. I don't see any reason why you couldn't send this email to the 24, 25 committees, the board chairs, the committee chairs, and say, we're just introducing ourselves. We do these things, or we're interested in doing these things. If you want further information, contact the SMART Committee's meeting coordinator, Henry Thayer, and see what you get. I mean, I think that what you're going to find is that A lot of committees would like to have a conversation with you. I think that some of those conversations are going to be more fruitful than others. I think that the amount of thinking that has gone into measurement and analytics and frameworks even is different depending on the committee. I think the Housing Collaborative is all over this stuff and will, welcome and be ready to be a good partner. I don't know that that's true of all of the committees.
Yeah, but I'll just say, Jason's right. Like when I sent this to Henry and Rob, it really was for the approach to the other committees. And so, hopefully we can come out of this meeting with something if that's what it is. And then the other committees can respond to us, as Rob is saying, with what their questions are. And then we can look at what the responses are and think about what's our skill set and our ability to meet the requests and demands of these other committees.
I like that.
Right.
I'd also suggest it's not a contract. I mean, you're not contractually obligated to do these things and only these things. So, yeah.
Agreed.
And it would help with us setting an agenda for ourselves if we had, we were able to compile a list of what these other committees would like to know and how we can help support them in their work. And then once we have that list, we can work together as a committee to prioritize and recognize some of those things are things we may not even have the capacity to respond to because we don't have the data to answer the questions that those committees have. But when we do have the data, we can, again, prioritize depending on what we think our abilities and capacity is. So I agree. I think in order to set an agenda, we need to know what the needs are before we just launch into our first project.
Right. Henry ended up from last meeting, thought maybe this could be a framework or a template for the mission statement itself. But again, we get into the debate, which, I think we had at our first meeting in February is, can we create the topics ourselves and what would that look like versus, can we just meet the interest, demands, requests of town council or these other boards, and then that by that way there's some transparency, a little, maybe of we're just meeting a set request from other groups. And so maybe that's something that still has to evolve. I'm not sure. I mean, I ended up liking this somewhat as an idea, as a mission statement with, if Henry thought of it that way.
Yeah.
But I think, we've kind of two different categories of thinking about what our actual mission is.
One way to look at it is start with what the needs are. And if we find ourselves lacking any work, we need to reevaluate our role.
I think you could think of this as our first project, which is to conduct a needs assessment of the various commissions and committees in the town. So if you think of it that way, this is our own data collection for the SMART committee so that we can plan our work moving forward, but we can't plan our work without a proper needs assessment.
Okay. That just made me, hey, Rob, question for you. Does Colleen have the email addresses for all the committee chairs?
Yes.
Okay, good.
And I've just made a major change here. I'd also suggest we send it to the department heads.
Okay.
Do a needs assessment, let's do it.
Good idea, Rob. Good idea.
Did we ask, or Henry, did we ask the police department to send us the data that they talked to us about?
They are still trying to figure out how to pull the data from the native database. It's a law enforcement database that is ultimately designed to get accident data to the federal government. It's not a great format, but they are actively figuring out how to port the data out. And we're working with Carol to figure out how to get those to a map, because we don't have a map of where accidents are, which is just crazy.
Mhm.
In fact, one of the things that they're working through is they've only been collecting lat long data for 5 years. Before that, it was just the nearest intersection is, which means we'd have to go through and geocode all of those prior data, or all of those prior accidents. It's just a pain in the neck.
Well, because I thought part of what was interesting about what we learned from them, from that discussion, was that they seem to be really focused on traffic safety, and there wasn't very much on, there wasn't much crime data, not that I don't know. It just seemed like they wanted to know how fast cars were going and how many cars hit each other. And it seems to me the police department should be good for a lot more information that could be helpful.
They are. That's a function of Sergeant Sosa being our traffic enforcement officer. He came to this meeting with his focus. Yes, there are other data out there for sure.
Okay, because while I'm not sure what it would be, it just seems to me that it was just very narrowly focused. And I mean, Carol, we went from one end to the other because Carol will do anything. So, but I think it would be important if we do have these people come and meet with us in this committee. It would be good if somehow somebody, Henry or whatever, managed to follow up to make sure they didn't forget what they were supposed to provide us with.
Yeah, going back through one of the meetings recently, the concept of a data maven, and that function, just sort of harassing people about the data. You know, where are they? What have you done to get them in the right format? That kind of function is important too. So do you want us to send this email? I'm happy to do it.
Yeah, but do you want to add recommendations and a protocol statement too?
It's in there. The SMART committee can assist in establishing protocols for
Oh,
data.
I guess we can't see what you've got. We only see the email.
The email.
Oh, I'm sorry. I've been editing away here.
No, we haven't
No,
seen
it's me.
Sorry, I was sort of feeling, sort of, I don't know. Okay, so there you go.
Right, yeah, I think you just want to change facility to facilitate.
Okay, where is it?
It's like a little typo in your third paragraph at the very end.
Okay, yes. Although I like facility understanding too. We've got a whole
To facilitate facility understanding.
Okay, and in the second, is it the second paragraph? Who is for the board itself? Both-
Do you mean the town council itself, Rob, where you say
Who do you
board?
mean- Who do you mean for
That was meaning for whoever we were approaching. So if affordable housing, it would be for them. If it was for planning board, it would be for them.
So how about your board or department? And take out itself. Great. Can you scroll up, Rob, so we can, yeah, thank you. Nice.
I wonder if we just need to say, just make it clear that if we get a request, it's not necessarily to say it will be met.
Again, I think that
They
this
understand that.
contract, you can negotiate those things with them.
Yeah, I was gonna say, let's start getting requests first before we scare people away.
True. Well
Please
said.
work so we can tell you no.
Opportunities for collaboration is pretty non-committal in some respects. just opening a discussion, which I think is the most important thing at this level.
Okay, I think this is good.
I like this.
Yes.
So do we need a motion?
Yeah, I need a motion.
Oh, I'll make it.
So I will just point, good, you're fine. Yep,
Okay, hey Rob, just put my email address there. Henry_Thayer@verizon.net. Z,
Z.
ERIZ.net. Okay,
all right.
all right.
Need a motion to approve this and
Yes,
take action, or how
yes.
does that work?
We need a motion to have Rob send that out, and it's going to be seconded.
I can make a motion to direct Rob to send this email to the department heads and committee chairs.
Okay,
Second.
second? Can I have a second?
Got one from Kirsten.
Okay. Any discussion further? No, hearing none. All in favor, say aye.
Aye.
I,
Okay.
Aye. So it's unanimous. Susan, do you have something?
No, I'm just saying I vote.
Oh, okay.
All right, now you've got a push strategy. We're going to keep pushing department data folks at you, and you've got a pull approach.
Okay.
Folks, I like it.
Okay, going back to the discussion items on the agenda, I think we've covered A and B pretty well. Item C is the tax calculator tool. Rob?
Yes, so you may remember we had this tool that we had looked at a while back. What I'd really like to do is get the tool back out to this committee with an eye toward actually getting it out to the public this year. You know, we got all messed up on COVID again on this issue, but it was going to be a tool, if you'll remember, that would let folks sort of look at budget proposals relative to their own household income. I think it's a useful idea, but before I push anything out, I want to have the committee look at it again and their thoughts. I'm happy to talk about it now, but you haven't seen it in a while. So if you'd rather have a look at it again and then have this discussion at the next meeting, that's good by me.
Okay. So we'll move the agenda to item D, the need for a data repository. What do we have and what do we need? And Rob, let me ask you this. Who is your chief information technologist in the town?
Well, we don't have one. We don't have a chief information officer. We don't have a chief technologist by title. We have I think Lori's title may be chief information officer, but she is not, in fact, a information officer. She's the IT director, and her title may, in fact, be information technology director.
Okay, if we have her in our meeting, would she be able to discuss what databases exist out there?
Yes, she'd be able to describe most of the interdepartmental databases, shared databases. There's a lot of databases that are, sitting on people's desks, spreadsheets and data sets. They provide support, but it's just very ad hoc.
Yeah.
I mean, Lori Fox is the IT director. Lori Fox is called when somebody's data is no longer accessible. She's involved in the decisions about which vendors to engage in setting up databases and that sort of thing. So yes,
Okay, do you think, can you make it possible that she could attend our next meeting in November?
Yes,
Okay, very good.
I want to manage expectations. Lori's really going to be able to tell us what is there, not necessarily what's in each of them.
Okay, so she,
Name the databases. I don't know how deep into the, data design she's going to be able to get.
okay, so she's not a database administrator then.
No, we don't have a database administrator.
All
So,
right.
and Rob, who was going to come tonight? Was it going to be finance?
It's going to be, tax assessor.
Oh, tax assessor, right.
All right.
I think
We'll
the
get- we
tax
can get-
assessor can come next time.
Yeah, I think we can get Jean Bouchard's our tax assessor, and Lori. Lori can tell you an awful lot about the digital environment. She's going to be able to tell you how many databases the police have. She'll be able to name them. She'll be able to describe their purpose in a broad way. So Lori's a long conversation all by herself, but you're not going to be able to ask Lori, where the data come from, or in some cases she might know just because she's around them enough. But it's,
Well, is it fair, Rob, is it fair to say that she's going to have a 5,000-foot view of everything? Is that fair?
no, I think she's got a 5,000-foot view of most things. I think a lot of stuff that just gets stood up without a whole lot of IT support.
Okay. Okay, do we want to proceed to item E, the COVID-19 related data needs? I don't know about you guys, but I look at the COVID-19 data that comes from the state practically every day. And lately, every day that I look at it, I keep getting more and more indigestion when I look at our town. As you can plot on that graph when you or I came back into session, when the schools opened, when things started to tweak back up again. And so I guess what I'm wondering is, are we in the town reaching a point where we may have to lock down some more?
Yes. Yes.
Yes. Okay, so what are the general ideas, Rob?
The first thing that we've done is we've not moved to open town buildings further than they have been open. We were sort of on a glide path to opening up all of the town buildings and allowing the public unfettered access, but it's not viable, particularly town hall. Town hall's a really bad building because there's one entrance, and that one entrance is on the main thoroughfare from two parts of the building. And you have to go through that main entrance if you're going from the one wing to the other wing. And it's a choke point in that building. So there's really just no good way to manage the flow of traffic if there's a lot of people coming in and out of the building. I was in the building the other day, just sort of watching the flow, and I had a citizen coming in, a citizen going out, a person coming from the clerk's office, a person going from the tax assessor's office, and there were two other people just waiting for that group to get out of the foyer there, the main entrance area. It's a bad design. So we have kept the town hall workforce on an alternating schedule. We basically have one person in each department in the building. Everybody else is working remotely on an A, B, C pod rotation. So the idea is that you have one person who's there all the time. That's your A pod, your anchor staff. You've got a B pod that's in for 2 weeks, and then a C pod that rotates in for 2 weeks when the B pod goes out. That has now been switched up to A pod only We're maintaining only our anchor staff in the building, and we're limiting access in other public areas or other public buildings. The senior center is on alert. We haven't canceled programs yet, but we're on alert to reduce the program offerings at the senior center if this trend continues, and there's no reason for us to believe it won't. In terms of out in the public, the governor has reinforced, you'll remember here in South Kingstown, we had sort of had this off-campus party thing that we did, the emergency order that was designed to sort of get the kids to stiffen their backs and pay attention to not having off-campus parties. We had imposed a $500 fine for anybody who was at an off-campus party. The state has taken that $500 fine, and that now applies to on all gatherings that are more than 15 persons inside, and for restaurants and event or establishments like restaurants, dining outside, it's 100 persons. There are the $500 penalties at the state level now for persons who are violating the social distancing and mask wearing provisions of
That's something.
executive orders. Yeah. So I think that at this point, that plus cajoling is about, what we're going to see through Thanksgiving. If this goes as far south, if it goes as badly as some are predicting after Thanksgiving through Thanksgiving, I just, I don't know, Henry. I don't know what the next lever is. I mean, at some point, in Britain, they've adopted a 3-tier system. And the third tier, which is Lancaster and Manchester at this point, the third tier is you don't have contact with anybody outside your household, period.
Yeah.
London's in tier 2, which is highly restricted, but not quite as restrictive.
Wow.
It's bad. I mean, this is not looking good right now.
No, it is not. Especially when your wife has to get tested every week because she works in a nursing home.
I understand that.
I just got tested this week myself just to make sure. So it's something that, inside the house, we're all paying very close attention to it.
The other thing the state's doing, which I'm not sure how I feel about it, but one of the strategies that they're pursuing is an initiative they're calling Take It Outside. And the idea is to keep the outdoor dining and keep businesses operating outdoors for as long into the winter as possible. So they've given grants. The town of South Kingstown's received 75. Well, I shouldn't say the amount. We received 50, and we're in line to get some more money out of that program. I understand the governor hasn't announced the second round, so I'm not going to announce that here. But we do have more money coming our way to help local businesses buy heaters, buy tents, buy lights, so that when we're in the darker and colder months, they'll be able to continue serving outdoors. My concern about that approach is that the tents now, because we're into the winter months, have sides, and I'm not sure that we're going to have the air circulation, the ventilation we need to actually keep it outside. I mean, at some point, a tent with the flaps down is inside. So I'm a little nervous about that approach, but it's one of the things the state is pushing.
Okay.
One of the things I'd like to see discussed a little bit more. I mean, from this group, we're talking about data. I keep seeing policy decisions driven by, it's literally a single data point. What are the new cases per day? Yet these policy decisions have implications that go far beyond quality of life issues. So there are discussions that aren't even being had because the only thing anybody ever looks at is new cases per day. And that doesn't take into account the fact that healthcare professionals are handling this, getting a handle on this more and more every month that goes by. And these other numbers that are there, I think some of what we're seeing at the state level is a little pushback on the idea of full lockdown because of those things. The hospitalizations haven't spiked to the levels that were there. So this is a little different than what it was in March when we didn't know anything about it. But they've also seen the economic damage that the 2 months of lockdown really did do.
Right.
And those have other, I mean, we could talk about these till we're blue in the face, but what are we looking, or what is driving some of your decision making?
Right.
That is it more, I know it's more than just new cases per day, but it has to be
Right.
comprehensive.
I would say that
So,
from what I've seen from the state, they are using more than one data point, and we are at a place where we did do a pretty decent job of knocking the infection rate down during the summer, so that we're not right now in a situation where we have to lock everything down. But we're at a situation where the trends are definitely recognizable, that it could get a lot worse. So this is the time to start to make some decisions that can hopefully let us get through this wave without having to go into a full lockdown.
and
I would just say yesterday I saw data from the state of Indiana where the governor dropped all restrictions that were COVID related. And then within 2 weeks, everything was spiking dramatically. It was an exponential rise in cases and in hospitalizations. And it was frightening to see. So it just goes to show when you have no restrictions, that's not a good place to be either. So there's got to be some kind of calculus in the middle, right, in terms of balancing all the different needs. But to go no restriction, at least from that one, if you use that as a case study, was very scary. And I'd recommend you look at those data. They've been made public. They don't look good at all.
Don't we have pretty good compliance on mask wearing? I'm pretty impressed. No, not in
Sorry,
So-
I was going to jump in, Susan. I don't mean to cut into your stream of thought. Go ahead. I wonder if we don't need to go back to what the town currently has in place and more firmly and assertively enforce that. I wish that I had started taking down touch points and actually writing it so I could submit it to this committee as a form of data collection. But between the supermarket and going for a run, the seawall is absolutely, I'm never going back again.
Yeah.
Never going back to the sea, and I'm a runner, so I'm not even on the sidewalk. And so the mask wearing, the alternate ways of walking and hiking are not being observed in the markets. You can't walk down the sidewalks in Wakefield. You can't walk down the sidewalk. Somebody's coming right at you without a mask on. I wonder if we go back to the restrictions we have. I know I visited my older daughter and her family who live in Brooklyn a few weeks ago, and it's an immediate, very big fine if you walk out on the street and you don't have a mask on. Can we do something like that? Go back and reinforce what we have in place. I don't know if that's possible. Sorry, Susan, I didn't mean to.
No, that's okay. I mean, the only place I don't go out, so I don't know. My question was, but I do go to Belmont, and I am annoyed at the people who don't follow the line, don't go the right way. But I've so far not become the nasty old lady who says you're going the wrong way in the way. But I'm working on it.
Right way, yeah.
I'm getting there. But I think everybody who goes to Belmont is wearing a mask.
Yes.
So, and that's the only place I go. So, I also go to the post office. So those two places seem pretty good, but I don't, that's why I asked. The other thing I wanted to mention was flu shots. I know there's no data to suggest whether flu shots are going to help or not, because there's all this question of what kind of flu season that's going to be. But it seems to me it wouldn't hurt to encourage people to get a flu shot. That could keep people out of hospitals or.
And further, from a workforce point of view, a presumptive positive is a positive. So if you're showing the symptoms and you can't tell whether it's the flu or COVID-19, you're out of work, and everybody you've been in contact with is out of work.
Yeah.
It's real. Yeah. I mean, the flu shots are a big deal. I guess to answer your question, Roland, what is the framework within which we're doing local policy on this stuff? My approach to this is mostly that it's just a probabilities problem. Every contact has to be, unfortunately, equated with everyone else. I can't weight them. I don't have enough information to know whether contact in town hall is more dangerous than a contact at the 7-Eleven or at the Burger King. So what I've tried to do is take us out of the equation as much as possible, reduce the number of contacts that the public employees are having with the citizens, so that the citizens are free to have more contacts with each other. Just increase the available number of contacts by reducing the number of contacts in town hall, by reducing the number of contacts in non-mandatory, in truly discretionary, non-essential programs. If it's not essential, we shouldn't be doing it, because the best thing we can do to ensure that the private sector can continue to engage in transactions is not have transactions that double up our probability of having an infection.
Rob, is there any sort of data support that we can offer in response to this? I mean, I'm just thinking about
this is what I was trying to get to, Kristen, also, just the idea of, because Rob, what you're describing is you're trying to affect this number of cases still. Now there's a corresponding result that should also be measured, and just off the top of my head, I'm thinking something like this will have an effect on employee morale, will have effect on.
Sure it does.
We know that there's a mental health aspect to all these policy decisions that has a different outcome that we're not even considering in any of this.
Oh no, we do. I mean, our aid pods have been designed around who's really not going to make it well at home. The aid pod in several departments is someone who simply said, I can't do it. I don't want to be I don't want to be home alone. We are taking into consideration as many factors as come at us as we become aware of. There's clearly things that we don't know. There are things that we cannot calculate for sure. But if we know that we've got a challenge, morale, for example, we are addressing it. We're not doing policy in a vacuum and saying, well, you got to go home and hopefully, you'll still be there in the spring. We're engaging our employees in ways that are designed to make sure that they're not feeling isolated. The idea of rotations was for that purpose entirely. The idea that we're not just an A pod under normal circumstances, but we had these 3 rotating pods was to make sure everybody did have an opportunity to get out and to have social contact with their peers. But the 2 weeks is 2 weeks because we know that that's how long it takes for the virus to manifest as disease. So you've got a 2-week rotation and you've got the chance for everybody to come in every once in a while, which is not great, but it's better than complete, a lot of offices, a lot of businesses have simply said, that's it. We're not paying rent for the next year. We're obviously not paying rent, so that wouldn't give us any money. But, my point is we're also not just shutting folks out of the building.
Yeah, I guess my question was, is there any design or it's a bigger problem? I mean, part of this is because it's a multi-level problem, right? We have institutions in town over which there is no real control from the town side. We have the state level mandates, which are going to differentiate and likely overwhelm or and certainly supersede municipal level responses. So are there any specific municipal level needs that we can help with? Because certainly we are very good at knowing what we don't know, right? Which is almost everything about this. But there may be a few things that we could at least design a strategy to get some traction on. So if there is something that we could do with that, even if maybe that would be,
So one thing that would be helpful is this is a behavioral problem. I mean, this is really, how do you get people to recognize an invisible danger? In many ways, it is an invisible danger. I mean, part of the reason this feels so over the top, I think, Roland, is because folks are screaming about it because it otherwise is truly invisible. So, there's this really strong drumbeat about COVID, because if you don't do that, then there's nothing until you're on the ventilator. Figuring out how to influence behavior in subtle, careful, quiet, non-intrusive ways would be designs around, I don't know, sort of economic, behavioral stuff would be useful. So for example, every time I go out, I wear a yellow vest that says Town of South Kingstown COVID enforcement official. It's a big yellow vest that, has this written on the back, and people pay attention. They see the big yellow vest and they go, oh yeah, thanks. I'm glad you're out here watching out for me. Or you get the dirty look like, oh, and the mask goes up a little bit. The point is I'm not issuing tickets. I'm not telling people they have to do anything. Walking around with a reminder that we've got a problem that everybody has a responsibility to deal with. That works, but it's a very small intervention and is not very replicable.
Is there anything?
5 of those vests around town. But
is there anything we can do to quantify what Roland was talking about, the secondary effects of COVID in town, as far as need for mental health services, increases in need for services that the town would actually have some role in ameliorating or dealing with, if we had an idea of what the actual effect has been locally?
So we don't have a mental health agency. It's Thunder Mist, it's Johnny Cake Center, who are the ones who come in contact with folks who identify as having that problem. And they come in contact with folks, the senior center does to some extent too, and I'll come back to the senior center. They also come in contact with folks who don't necessarily identify as having the problem, but because they have regular contact with them, they recognize the problem. So that's where the data are going to come from. It's going to come from Johnny Cake Center. It's going to come from Thunder Mist. It's going to come from the Meals on Wheels program. What I'm being told is the biggest challenge right now for at-risk populations, for want of a better phrase, is housing instability. Isolation, actually, folks seem to be doing fairly well with. That's just anecdotal reports from those 3 sources. But, housing is a real challenge. People are losing.
I have a million things I could say about all of this because
I'm
a psychologist and I'm a psychological researcher. The science of behavior change is what I do every day. But I think in terms of like doing an assessment, I think that's very challenging. One area that I just anecdotally, because I get calls and texts all the time because of what I do professionally, are people seeking services and not being able to access services. There's like every private practitioner is full. Everyone's on a wait list, or they don't even have a wait list because they can't take any more people and they're overwhelmed. Local services are completely booked. It takes months to see a provider. And I mean, I've worked at Brown for 16 years. I know people in the entire Brown medical school system. I can't get my friends in to see experts at Brown because they're all booked. Bradley has been full this whole time. Literally like maybe one open bed for teens. And youth. So, one thing that we could maybe think about is trying to understand what are the needs and what kind of access is even available to the community.
So, Lauren, I haven't seen any measures of like substance abuse increase or anything like that.
Oh, there's been a huge increase in opioid overdose deaths during all of this.
And that would be and suicide numbers would be,
Suicide, actually, I have a lot of insider info on that because that's what I do. And it's not public, but there was a big drop actually during the initial lockdown in terms of suicide related emergency department visits, which is not a surprise because all emergency department visits went down during that time. And there was some kind of a rebound sometime around July and August where the rate started to go up again. But when you compare similar quarters from 2019 to 2020, we're seeing increases in suicide-related emergency department visits, but the group that's impacted the most has been the group 25 years and younger. We're not seeing quite as dramatic an increase in other age groups, but in the youth, we're seeing a significant increase.
And we have seen police calls, domestic disputes are up. That's data we actually have in our possession.
Those would be interesting to look at as well. And it makes sense if people are trapped in their homes in these unstable relationships, you would see these, and then you increase substance use and it's a recipe for not great outcomes. But I think in terms of understanding, I'm alarmed at how difficult it is for people to get help. And it's one thing is to even recognize you need help. And the second thing is when you're ready for help and then you call all around and you can't
get anybody.
You can't access any services because all the services are overwhelmed.
Is there a way to do some sort of capacity assessment? Like, is there any capacity? But that's, maybe we can't do surveillance on the population, right? And I don't mean surveillance like going in with a camera. I mean, data collection, but if we could actually look at capacity utilization, how many people are taking additional patients? Are there what is the utilization of open appointments as particularly either trauma or emergency based referrals, even just within the town? Are there providers that have space for people? And how has that departed from maybe a pre-COVID average space level? That's meaningful information, right? Because it tells you something about the needs of the population and where there's a real substantive lack of access. So I don't know, I'm just thinking you can't maybe you can get at the other side of it, right? Is you can measure whether or not there's any capacity.
So you're right. And when I report that I've had conversations, it's clear that that's not what's really going on. That's just the stories I've heard. Maybe it is worth sending a survey out to South County mental health providers and see, what's going on. Maybe
I'd be interested in knowing. I don't know, Lauren, if this is possible, or Jocelyn, or whomever, is how many flu shots were actually dispensed in South County? I mean, every time I go into CVS, there's a long line to get a flu shot. I've gotten a flu shot, that would be interesting to know. Is there any way to find that data out? Other than going to CVS and asking them?
Yeah.
I would imagine that that would just be a simple phone call, but you'd have to call every single primary care office as well and walk in and urgent cares and flu clinics. And that's a pretty big data pool to try to collect anything meaningful.
Could you go to the Department of Health and ask about the number of doses that have been dispensed to all providers in South Kingstown? Because I think that would, I mean, that doesn't guarantee all of those doses have been
given.
delivered, but at
Yeah.
least we know, like, in terms of how many doses of the flu shot are
Yeah,
available.
I
It's a
can
rough
support that.
proxy too, which is meaningful, right? Because
You what, please, say it again, please, Kristen?
it's a rough proxy, right? You'll get some reflection of utilization in the distribution, you hope. So
It may be cleaner than trying to call all over Washington County.
Yeah.
I guess my question would be, what do we know if we know how many flu
Yeah, that would be my question too. I mean, to go back to the matter of who needs mental health services, how can we help them connect? Even if we know the capacity, how can we help people get the services they need? Or how can we, it seems to me, how can we help if they need help with meeting their rent payment? I mean, that's not the kind of thing that the town has the resources to do. And certainly the federal government isn't stepping up to do anything to help with the rent payment. So I guess I'm wondering what it is how we would use this information once we got it.
Maybe the question too is not necessarily what we would do with the information, but if we compile this information and bring it to a body like the town council, could they use that information to guide some policy or decision-making at the town level? So it's not so much our committee has to take action on the data, but would the data be useful to another body in town for them to take action, a policy?
Yeah, I didn't mean those people on the.
Oh, yeah. Okay.
So
Yeah.
this is actually a really interesting conversation because it ties neatly to the whole, defund the police and redesign law enforcement. It ties to a problem we had pre-COVID in a very interesting way. One of the things that we've seen for years in law enforcement, local law enforcement, is that a large and increasing number of the violent crime responses are for people who have some sort of mental health crisis going on. That's been a trend for a very long time. So police departments have been taking on clinicians who come with them. They ride in the cars in some cases. They respond to crises and events as they occur. But it really is a very reactive system. So one of the things that people have been trying to figure out for the last few years is, how do we do interventions before they become crises? How do we keep the cop from having to show up? How do we identify and provide mental health before the police officer has to show up with a gun and respond to someone waving a gun at them? Let's figure out how to keep the kid or the senior citizen, for that matter, from waving the gun in the first place. So let's get the interventions early. This is maybe an opportunity for us to begin to address the infrastructure that simply is not in place. We don't have anything in local government here in South Kingstown, and for that matter, in most places, certainly most places our size, that is designed to figure out how to help people find help before it becomes a crisis. So we're dealing with COVID isolation and the mental health issues. We're not dealing with them, frankly, because we don't have the infrastructure. And maybe this is the right opportunity for us to begin looking for ways to do small things that move us toward a longer term solution. It's really a very interesting opportunity. I don't know what to do about it, but we need local governments to have something in place to deal with mental health. What that something is, how big it is, how small it is, how expensive it is, how comprehensive it is, I have no idea. But it is clear that this is a gaping hole in law enforcement, and it's a gaping hole in society. We just don't have a way to keep people who are on the path to crisis from continuing on those paths.
A good place to start would be at SoCo, you know, finding out what the hospital and the hospital system
Yeah.
have in place to meet the needs and coordinating with them, because certainly they have the expertise and the professionals to provide that level of care. It would be a coordinated effort first in meeting with them to see even what kind of data collection they've done. I don't even know what kind of assessments they have done. So interesting conversation though.
Yeah.
I think I'd be,
Yeah, and does it, when do you put together the budget, Rob? Doesn't that start, aren't you working on that now?
Yes, we present the first part of the budget in December.
Yeah, so I mean, there aren't any grounds here for making any redistributions, say from policing to mental health, but ultimately, I think that's what we'd want to do, not this year, because there's no basis for it, but maybe I mean, that's.
Are we doing the ride-alongs locally?
We have through Thunder Mist a clinician who will respond to crises.
But are they riding in the
Not
squad cars?
generally, no.
Okay.
No. They're
So if
called,
I could just maybe make one quick suggestion on this then, because we're still talking about offsetting information that might be negatively impacted by policy decisions to deal with COVID. You mentioned a few things that we do have information on, things like domestic incidents calls, things like substance overdose calls. I would imagine we have some information on that.
yeah.
Those are, can you get that readily in real time?
Yes.
I think those are important things, and if they go into some kind of repository as a secondary measurement that we can use to gauge decisions, it may also become available for other things, like justification for the kind of things you're talking about. But for us, really, for this committee, I think those are the kinds of things I would really like to see to make sure that we're not just making decisions based on one outcome that we care about and ignoring every other result.
Yep.
Do we do any contact tracing
No,
in town? So
we really don't.
because that would help
Health.
Roland's concern. That if we knew, if you knew that a certain bar or a certain restaurant or something was a place, I'm changing the subject.
Yeah. So no, the Department of Health does the contact tracing of the state. They do that contact tracing fairly quickly, although as numbers increase, they're not as efficient and effective. But they do that contact tracing, and we often don't even have the patient zero to be dealing with. We don't have the initial positive to begin looking at. We do when we have a positive test or a presumptive positive among our workforce, do contact tracing, but that's the only time we do it. And we only do it because we can do it faster among our own employees than Department of Health can.
I mean, just thinking earlier, and it's an assumption I make as well, so that I'm admitting it's an assumption, is that, our rates locally have gone up, and we've sort of made assumptions about URI students kind of driving that. But do we actually have data to support those assumptions?
Yeah, we do. The last data I looked at, we are trying to do regular meetings with the department, with URI. And the data they reported from last week was that we had 40 new cases for the reporting period, which I don't remember the dates of, but and half of those were URI students.
Other issue.
Not the majority.
Right,
So can I just finish my thought real quick? It's just,
okay.
I feel like there might be other places where infection is spreading that are being overlooked because so much attention is being spent to the URI students. And if there's certain, like the governor's talking about gatherings in homes. And so those are not in public and you can't see them when they're happening, but she seemed to think that was the source of infection spread. I don't know if that's relevant locally, but I do think if there's a way to compile data where we could identify the context in which these infections are spreading, even if we're not doing the contact tracing, that it could be useful.
We're not going to get those data because we don't know the patients, the privacy issues, names and addresses. We have some information. I shouldn't say we never get it. We get some information for the paramedics and law enforcement, just so that they know they're going into a COVID positive environment, but it's very limited.
Okay. Yeah, you can't. So we can get de-identified data that just says like case A was in a private home and case B was at the university or the frat house, or it doesn't have to identify the person, but it would be helpful if we had.
The state doesn't produce those reports, but I wonder if they'd be willing to produce that. I don't know the answer. I mean, the truth is they're running around like crazy, so I don't.
Yeah, I understand there's a lot of burden on them right now too.
I want to be clear. We're not taking the position locally that URI is our problem. URI is a population that is special in terms of the way the disease is transmitted, because we know that science is not as good. We know that young people, behave differently than mature adults, but it's not the case that they are, without a doubt, the source of all contagion in South Kingstown. It's just not the case. It's just not. Some of the folks who may be among the others in that 40 increase, however, may have been in contact, because it's a relatively small area, with students from Narragansett or students at a restaurant in Narragansett. Or there's a lot of stuff going on here. The URI population is an important part of the puzzle. I don't know, I certainly don't think that they're the only source. We know that. We know that.
I will say that will become a little bit more clear given that they just required testing of all students, right?
Right. And we know
there's tremendous amount of isolation being utilized in quarantine.
Yep.
And so I do think that
we know the positivity rate is below 2% for URI students being tested. That having been said, we also know that the tests are very bad at detecting disease early in the infection. So what we're finding is that we are seeing presumptive positives that never get retested, because you don't want to send somebody who's presumed to have COVID back out to the doctor and back out into the community. You want them to isolate. However, URI does do follow-up tests, because their students are put to isolation that is congregate housing. The follow-ups among URI students are showing that negatives turn positive fairly often. I don't have the specifics on that, but they're seeing positives after negatives quite often.
Did you finish what you were going to say?
Okay, do we want to move on, or are there any other comments on this topic?
Well, we didn't get to closure on anything.
I actually think we do have an assignment, and I appreciate the conversation, because I think we do need to dive into the police data and try to figure out overdose, public drunkenness, perhaps domestic disputes. I think we've got to mine that data a little bit and see what we're seeing.
I would recommend suicide-related calls as well.
The challenge for us is going to be, maybe we have to do this with Narragansett and Charlestown. The problem is our numbers are just small. They really are just small numbers. So it gets to be hard to draw any conclusions, but let's see what we've got.
And how about the homelessness problem? If people aren't going to be able to make rent, is there any?
Yeah, that's going to be tough, because what happens is, and in fact, there was an article somewhere about a woman who was in Virginia who had left her home in South County because, you know, she couldn't pay the rent, and somebody let her crash on their couch in Virginia. I mean, it's really, really hard to track what's going on, because when you lose your home, you couch surf, you find a way, and you often just aren't in the community to be counted anymore.
Okay, so Susan,
What?
we're all set, Susan?
Yeah.
Okay. The next topic we have on our agenda is Economic Development Committee on discussion regarding data sources. Now, Susan and I had talked to our colleague, Jay Newsom, in the last meeting we had. Susan, did Jay get back to you with anything?
No, I was gonna say, I don't think we have anything new to discuss here. Jay was supposed to send me some stuff that I realized as I was coming into this meeting I hadn't had from him, so I'll follow up.
Okay, I haven't heard from him either.
Okay.
All right, so that brings us to item G, other items of interest. All right, other items of interest. The big elephant in the room is November 3rd coming up. I'll be working the polls at the Elks Club as a moderator, and this is going to be a very, very interesting election. Just as a statistical thing, Rob, does Sue know? I mean, Sue Flynn, does she know how many people are have voted, you know, by mail or voted early?
Yes. We know how many people have applied for mail ballots, and we know how many people have showed up at the town hall garage to vote. We know both of those things.
Okay. Is the number a substantial number, or is it?
Yeah, it is.
Yeah.
It is. And, you know, it's conceivable that you could see better than 50% of the votes in this election cast before Election Day.
Wow.
There's 7,000 rounds.
I'm sorry?
There's a little over 7,000 mail-in applications.
That's correct.
I just looked online as of 3 hours ago for the state, 17.5% have already voted.
Yeah.
Or their votes have been received anyway by the.
We're running higher than that. 7,000. We've got 23,000 registered voters in South Kingstown, 7,000 mail-in ballot applications, and we're seeing about 320 people a day at the garage.
Wow.
I asked for a mail-in ballot, and because I had to do it in the summer, and I didn't know as an old person whether I wanted to go to the polls. And then I got worried about mailing in my ballot. So I read the fine print to see whether I could eschew my mail-in ballot, and it said no. If I did that, I'd have to vote provisionally when I went to the tent. So I voted and stuck my thing in the official box.
Yes.
I might have signed it incorrectly, because I signed it S. Marcus and it said sign your whole name. And so then I did it. I circled whole name and drew an arrow and signed my whole name. So my vote might not count.
Well, I hope it does.
Well.
Okay, so the thing is, after November 3rd, we at least know that we will have 2 new members of the town council, because Brian and Joe Veely aren't running this year. So we know that we'll have that. And then on top of that, there's going to be changes in the school committee too, because in the primary, Stephanie Cantor, she didn't make the cut. So it's going to be interesting. And we're going to have to see how we're going to have to adapt to whoever is there and what we would have to do to educate them. Okay, Ron?
Okay.
Well, one quick point, going back to the previous discussion a little bit, it's an additional question. Is there anything we can look at in the housing data as to determine if how COVID changed the influx of people from out of state buying properties here versus whatnot?
Yeah, we've done some actually. I was working with Bill Seymour, independent reporter over at Independent, an independent reporter at the Independent. And he had asked the Postal Service for
Change of address.
address data. It's not, it wasn't, this was back, I think I sent him your way, Kristen. Do you remember when that was?
You sent me that too.
Yeah.
Good look. But I'm not sure. It was during
May
the
or
summer,
June.
like,
Yeah, May or June, maybe.
yeah.
It was sometime between March and now.
Yeah,
Yes.
right. It wasn't at the time all that interesting though. It really,
I feel like we were still doing virtual school and it was sort of at a bad moment. So,
yeah. Maybe we could do that again. I mean, I've seen that study replicated. The New York Times did it not too long ago. We could do that again. We could ask the Postal Service for those data.
Well, does it look like there's an increase in the number of kids going to school? I mean, it's
No, it really didn't. I mean, again, this was maybe June, maybe July. It was small numbers. It was, 23 South Kingstown folks coming from New York and Connecticut, basically. There were a few Massachusetts change of addresses. And it looked like, a net immigration, but it didn't look like big numbers.
2 houses on my street for sale.
Mm.
They look like they would be New York and Connecticut.
The Zoom CEO was in an interview yesterday or the day before, and his prediction is that this is all going to level out, even in the New York metropolitan area. Toward the end of this year, it's all going to sort of begin to level out. So we'll see. I don't know.
Yeah. Keeping in mind that the flu pandemic of 1918, I think took 3 years to level out.
Oh, no, he meant the housing market.
Oh, okay.
The migration patterns are going to sort of level out.
Okay. The 9 o'clock hour is coming upon us and gives us enough time to go and get our popcorn and watch the debate on TV. And
Yeah, I wasn't doing that either, but
all right.
Susan and I were waving together. No.
I didn't even have a TV, but I wouldn't watch it. I could watch it on my computer. I'm on, no, over and out.
Okay, so the next meeting date is going to be the 4th Thursday in November. Rob, that isn't Thanksgiving, is it?
Oh, the 3rd Thursday, right?
I think it's the 4th is Thanksgiving. I looked before our call.
Yeah.
It actually is the 4th, 1, 2,
Yeah.
3.
Oh, is it? So the 26th is Thanksgiving?
It is.
Yeah.
All right. So what do you want to do?
Do you want to do the 3rd Thursday? Kristen's nodding her head.
Agree
So
with that.
3rd Thursday would seem like the optimal
19th.
to do, because if we try doing it any later, everybody's going to be busy trying to have some kind of a Thanksgiving dinner and so forth. And if you do it any earlier, won't have time to get together some of the data that I'd like to try to play around with.
I'm
All
not
right.
sure
Well,
I'll be able
we
to
actually-
make that time, but if everyone else can, I understand. That's fine. I have something in my schedule about a rabbi, some meeting with a rabbi that I don't.
Part of a joke, isn't it?
Yeah. Rabbi Rothstein is in my schedule. I don't know.
Okay.
You know
Last
how
week,
it goes.
are you good with Thursdays now? I know there was a time you were talking about.
If I have a TA, this right now is dissertation and exam week. So this week was great. Exams are over and they're getting their things together to submit. So I'm great at, that's the beginning of a semester or early midpoint. I should be fine. I appreciate your indulgences with my schedule. Normally I have a TA. It just happened my TA got sick. So
God.
I'll do the best I can. Definitely the 3rd though. The 3rd's fine.
Okay.
January will be tricky for me.
Seems like we have consensus for the 3rd Thursday.
At 7 o'clock, November 19th at 7 p.m.
That is correct.
Wait, November 19th? I thought we were talking December 3rd. Sorry. And that's fine. That should be fine with me. I should be fine.
Okay.
Yeah.
All right. Can I have a motion to adjourn? Susan's motions. Anybody second Susan's motion? Kristen seconds. All in favor?
Aye.
Okay. Have a nice evening.
Night all.
Thank you.
Well,
Good night,
folks.
everybody.
Okay. Good night.
Good night, everyone.